We hope all of you are having a great day. And if you've seen the news at all lately, then you know we've talked a lot about COVID-19 testing. But what is it really like? This morning, we have two women who can tell us firsthand. Melissa Odell is a healthcare provider with CRHPC, and Shirley McEwan is a recovered COVID-19 patient. We're so happy to have both of you ladies with us. Melissa, I want to start with you. What happens when someone tests positive for the coronavirus?
So the first thing we do actually is we bring them into our office to provide the testing. We are keeping the patients who have symptoms that are COVID separate from our other patients because it's important for them to keep coming in for their appointments as well. So when they do come in, we do the testing. It is a nasal swab. It takes a couple days to get the results back, and then we know it's positive or negative. If it is positive, then we basically will be monitoring the patient very closely a couple times throughout the day, communicating with them to see how they're feeling, basically give them information if they were to worsen, what they should do.
And Shirley, I want to bring you into this. We are so excited to speak to you today because you have recovered from COVID-19. So what were your symptoms and when did you know it was time to get tested?
Well, for me, I started out one late afternoon, just kind of out of the blue, all at once with a sore throat. And then I had some sinus and ear congestion as well. I really honestly thought it was just my allergies, which I have pretty bad, especially during the springtime. But the next day when I woke up, I had a low-grade fever and a dry cough, and I just felt very tired. And it wasn't just a day or two after that, I had other symptoms. I experienced a really bad burning in my chest and also in my eyes, and my eyes were very watery. I also had some nausea and a little bit of loose stools. I had a very bad headache with some body aches as well, and especially in my lower back. Then I guess it was over a week or going on 2 weeks later that I developed the breathing issues. And I had a lot of shortness of breath and dropping oxygen levels. I went ahead and called my provider like the next day when I ran a fever because I have an autoimmune disorder and I take medications that lower my immune system. So I went ahead and called her at that time to go be seen at the office.
And Melissa, what can someone expect when they do get tested for COVID-19?
So it's actually a pretty simple procedure. We try to make it as easy as possible for you. It is a nasal swab. Basically, it's 10 seconds on each side of the nasal cavity. And then we basically do vitals, a full assessment, listen to your heart and lungs, and then we'll send you home. We give you instructions at that point. You really need to stay at home away from other people. That's one of the important things, is to protect others around you too.
Melissa and Shirley, thank you both for joining us. Testing is available at all CRHPC locations for COVID-19. Call the COVID Hotline at the number on your screen. It is 1-800-408-7351 or visit crhpc.org to